One of the toughest cases that I've dealt with recently involved a family. It was mother and father and 3 children. And what made it especially tough was, while we had an idea that something was going on, the oldest son had made some allegations in school that he then pulled back, but there was enough for us to suspect things, and the service facilitator really suspected some things, but there wasn't necessarily enough to go on. I think prior to filing the MUI, we decided to go out and try to talk with the family, and we were really lucky because the father wasn't home and the mom was home, and basically we were able to get some really important things out of her over time. One of the reasons was the service facilitator went with me. She was comfortable with him. They had a previous relationship, which I think made her feel safe enough to talk about the fact that basically they were kind of in lockdown. There was one car, which whenever the husband was gone, so was the car. So she wasn't allowed to leave and go places on her own. The kids had been physically abused in the past. There was less of that going on, much more emotional and verbal abuse. Some of that in the form of the husband was physically and verbally abusive to the mother, and the kids would witness that.
One of the most difficult cases that I worked on, or am also currently working on, involves a young man who is autistic and nonverbal, and he requires care 24/7. And so a couple years ago, he was at his home in a supported living environment with a caregiver, and he had soiled himself. And at that point, the caregiver clearly was frustrated and forcefully held him down in a scalding hot, or a tub full of scalding hot water. How we got involved, I think, is a good example of how our efforts to collaborate with the police and the Hamilton County Prosecutor's Office really have made a difference. So we have a 24/7 on-call phone. I happened to be on call that weekend, and I got a call from a Forest Park police detective who was at the hospital and said, "We've got this developmentally disabled man here who's significantly burned, and we suspect that it's abuse." Right away, we got them the information that they needed. We worked together to collaborate to get that caregiver out of there. And then unfortunately, subsequently, the disabled man was so seriously burned, he had to stay in the hospital for over 3 to 4 months. The caregiver was charged with patient endangerment. He was also charged with felonious assault and 3 counts of tampering with evidence. And as we were proceeding through the investigation, some of the details as it came out, it was so horrific. The caregiver waited 2.5 hours after the young man had been burned to take him to the hospital to get treatment. We think that it's because he was trying to cover things up. He had taken all the sheets, put them in the washer and dryer so he could conceal that the individual had soiled on himself. He also, we found out through his own admission, took a dirty safety pin from his computer bag and started popping the blisters on his own. So again, it was a really unfortunate case that's still in the court system. The judge has already said this is one of the most sympathetic victims that he's seen in his court. And so again, it's an unfortunate case, but what we have been able to take out of that is we have been going around providing trainings to caregivers, using this as an example, so they know that this can be a challenging field to work in. And if you're at the point where you're stressed out and you need support, let your supervisor know. If your supervisor isn't responsive to that, let us know. We've got a 24-hour hotline. You can always call us, and we can help assist in that, because it is very challenging at times to work with people that have multiple disabilities, but at the same time we want to make sure that those people that are providing care are providing good and safe care to the people we work with.